What is your name and profession?
Sumitha Ramachandran. I'm a family doctor.
And how many years have you been practicing?
21 years.
Wow. Where did you go for undergrad?
University of Calgary.
Where did you go for medical school?
University of Calgary.
Did you take any gap years before going to med school?
No.
Do you remember what your favorite part of medical school was?
I don't know. I like the lectures.
What specialty did you think you were going into on your first day at medical school?
Obstetrics.
What made you fall in love with your specialty? And what is your specialty?
Family medicine. And I think the first few times I did family medicine as a resident, I think probably in one day I saw such a wide variety of things. So that's what I found appealing, that it wasn't just like one age group, one type of person, one type of illness. So it was the variety that was appealing at first.
And how long does your training take after med school?
2 years. 2 years of family medicine residency.
Did you ever consider any other degrees?
I would have probably done a master's degree if I hadn't gone into medical school. So I considered it for like a hot minute, maybe.
And what would you say is the most unique part about family medicine?
Well, what's unique is it's like medicine from cradle to grave. I don't think any other specialty really has that longevity. And of course, the advantage of seeing families, for sure, other specialties might see relatives that have the same condition, but that kind of unique blend of that with like looking after families and generations, but also being able to look after them from the time they're born all the way till the time they are, terminally ill, let's say, or very frail. That's very unique about family.
Yeah, the longevity you're talking about. And why should someone choose your specialty, according to you?
Well, we are in need, and one day I will retire and need people to take over. So that should be the number one. But otherwise, I think there's great job security, and there's the need for primary care. I really truly feel like everyone in Canada needs a family doctor.
And on the other side, why should someone not choose your specialty, or maybe be a little drawn away from it?
There is a lot of administrative work that is under-recognized and underpaid. The government is slowly trying to negotiate with us and recognize the lack of compensation, but I think this is a long-term battle, and I also think the administrative burden may never end. There are always forms to fill out and always things that need to be done after the patient encounter is done.
And would you say there's any stereotypes for your specialty?
Assuming you're asking me about negative stereotypes, I think maybe, and again, I have some great doctor friends that do other specialties, but some probably think we don't know what we're doing, so we have to refer. We don't have as in-depth a knowledge of things, the whole jack of all trades, master of none idea, or that we don't have like firm, confident skills in our hands to be able to do procedures. So we're always like referring or outsourcing things.
What does an average day for you look like?
I arrive at around 8:45 and I start seeing patients promptly at that time. And lately it's been a lot of work through right till 4 and then sit at one of my computers, either in my room or here, just doing notes or writing out, filling out forms, and then try to leave here by around 5.
How many patients do you see in an average day?
About 30.
And what is the most amount of patients you've ever seen in a day?
I have worked here recently for a 12-hour shift. It was a mistake I made because I had to add on an evening, and I think one day I ended ended up seeing 65 patients.
Wow.
It's rare.
What is the hardest procedure you've had to do?
I do a lot of joint injections, but there are times where people come in with a joint that is inflamed, and so sometimes like I aspirate it and then inject it with cortisone, but you have to handle the fluid very carefully so as not to contaminate it and checking for infection. So it's more the coordination of things, not so much the difficulty in performing it. But I also have done this at least a few times recently without an ultrasound. So you just kind of have to know your anatomy and take a stab.
And what is the most common procedure you do? Like your bread and butter?
Vaccines for sure, if we're talking basic. And then pap smears, well, we now call it HPV cervical screening for women. So that's a common one, but getting less frequent now thanks to modifications in the way it's tested.
And do you have a sort of memorable case you've encountered so far?
Oh, wow. All memorable, but probably a memorable case I have would be a patient I had here for many years, and she was a wonderful lady that had so much wrong with her on an autoimmune level, never complained, always came in happy. And I feel privileged that I was able to participate in her palliative care treatment and end of life for her. So she was just someone I really appreciated as a person. And again, it's one of those cases where you see so much suffering, yet somebody's able to really overcome and take the high road in their attitude and their approach to life. So I really got a lot from that as a doctor and just as a person.
And following that question, what would you say is the hardest part about your job?
Not knowing things multiple times a day. Medicine is constantly evolving. Lucky for us, we have some great artificial intelligence apps and resources that we can use quite readily. You have to it's not all seamless, so you have to kind of integrate one into another and kind of process information, but at least it's helpful. But it is hard not to know, and it's hard to convey that to a patient because it does make it seem as though you're not confident, and that's when a patient knows you're not confident about something. I think it affects their trust. So you have to try to communicate to them that you're trying your best and you're trying to find answers for them without actually letting them know you're unsure of yourself.
And what is the most rewarding part about your job?
People are happy leaving sometimes, no matter what. They'll be suffering, they'll be having an ongoing issue, and if they leave feeling heard and they say thanks and they're okay with us waiting and giving time a chance and seeing me again, for me, I think I've done something good, and I feel that that's reward.
And how many hours do you work on an average week?
Does that include all the checking and lab results and all the times I log in at home onto my medical record system?
More at the office.
At the office? Yeah. At the office, I'm here 32 to 33 hours.
And then what about like the whole thing? Like if you were to put all the hours?
I'm gonna say 40 to 45.
Wow. What time do you normally wake up at?
6:05.
Specific.
That's my alarm.
And what time do you normally leave your practice at?
5.
What is the weirdest question a patient has ever asked you?
A woman once came for her appointment, sat down next to me, and just like looked me in the eyes and was like, "Doctor, do you think my heart is still beating?"
That's funny. Owning a practice, how do you manage being both a medical professional and a business owner?
I don't know. It's you kind of we had to learn it just by reading and no one teaches you about business when you're in medical school or residency. You don't learn about HR, PR, bookkeeping. You just have to learn it on the fly. So we've somehow just made it happen.
Do you have any pets at home?
No.
What is your favorite dish to eat?
Pizza.
Likewise. How much water should you be drinking every day?
I don't know, like 6 to 8 cups probably.
Any artistic hobbies you keep up with?
Yes, I dance. I do Indian classical dance. I play guitar, and that's about it.
Favorite sport to play and or watch?
Tennis.
What's the best way that you relax after a long day?
These days, jump in my pool.
Hmm.
With my kids.
Would you consider yourself more of an introvert or extrovert?
Introvert.
Would you say that personality trait is a factor in choosing your specialty?
Definitely, yes. I'm gonna say I probably am more of an extrovert at work, and that helps to keep the mood nice and light. I mean, people are coming in with grave medical illness or symptoms that are confusing and eliciting fear. So I do have to talk, but so you have to be used to kind of playing the extrovert, but at the same time, I'm introverted and very happy being by myself, with myself in a quiet space and being able to think and process things. So.
And what did you want to be when you were growing up?
The first thoughts are of wanting to become an obstetrician.
If you didn't do medicine, what do you think you'd be doing right now?
I have no idea.
Were there any times you doubted you'd make it as a doctor?
Yes. Mostly in medical school.
If you were to go back in time, would you change any of the experiences you got that brought you where you are today?
It was all very fast, but I can't think of a better way to have prolonged it. Bachelor's was 3 years long, med school was 3 years long, residency was 2 years. It's all really fast. But I think I learned a lot afterwards. So I came into it kind of not like, a young adult, and a lot of people start kind of in their late 20s, and I was a little younger than that, but I think I learned a lot and matured a lot after.
If you could change one thing about the medical field, what would it be?
It would be nice if everybody was guaranteed primary care. I'm just not fully sure of the process that is currently being suggested or talked about.
And what can medical students do right now to prepare for family medicine?
Watch this video.
What would you say to aspiring medical students?
Don't discount family medicine. There's so much you can do with it, and I think we're getting fewer and fewer graduating that are applying for family medicine because all they hear about is how disgruntled and tired we are. But it's a very satisfying job, and I think we have some terms to settle with the government as far as being compensated and resources available to us, but the job itself is very rewarding. It can be constantly evolving. You can change what you do anytime, but also don't discount the whole idea of being like a comprehensive family doctor at the start. It's a great career.
And are there any shows that you're currently binging?
I am currently throwing it back to 30 Rock from the NBC and watching it with my kids, and we're finding it hilarious.
Where do you see your practice in 10 years?
I still see it here, and hopefully I'll see it kind of more advanced technologically. I'm not sure how that's going to look, and I'll still be providing the same kind of care, and yeah.
And who is your biggest supporter during your medical education process?
My medical education. So we actually at University of Calgary had a faculty advisor program, and I was assigned to Dr. Jaylene Mannerfeld in Calgary. I'm sure she wouldn't mind me mentioning her by name. She was very influential, very supportive, was a very present mentor, and I still keep in touch with her and call her my forever mentor. She was an amazing person. She's still working as a doctor in Calgary, and in my career, my partner, Lita, is still forever inspiring to me. She just retired a few years ago, but we're very close friends. And she was just a really dedicated, amazing doctor with a really just personality. And so she's kind of mentored me in the career phase of my medical life.
Who is your idol? Who did you look up to?
My mom.
If you had a day with 0 responsibilities, how would you spend it?
Oh, I had one of those recently, kind of. No scheduled social gatherings or anything. It started with tennis really early in the morning, before it got really stinky hot. And then I think we actually went to the gym, and then came home for lunch. I had some errands to run. I gardened in the shade, and yeah, that's something I really love to do in the summer. And then jumped in the pool.
Perfect day.
We didn't order pizza. That was the only shortcoming that day.
Do you think AI will be able to take over your practice in the future?
It's possible.
How did COVID-19 affect your practice?
It shut us down, and it made us all fearful of getting sick. But as soon as we were given the green light to start seeing people in office, I actually approached that without any fear at all. I mean, I was safe, I wore the mask, and to me the priority was to get back and seeing people in person. I just didn't feel like virtual medicine worked for me.
And how do you deliver bad news to patients?
I will often preview it with a phone call saying the doctor wants to talk to you. I usually offer my first available opening or the same day. If there's some anticipation there will be bad news, I will often say, we will call you regardless to come in. That usually helps. And then, you just sit down with them, and I'm not into the icebreakers. Most patients would just want to hear it immediately firsthand.
And what are the benefits of owning a private clinic?
So it's the way it works is we're a partnership. We cost share. We own the contents of this place, and we run our own medical reception. We have autonomy over who we hire, how we conduct the place, hours and everything. And I would say the advantage is just having a say in how we choose to run our practice.
And what's the first thing you do when you wake up?
Have a sip of water.
Do you have any hidden talents?
Well, I guess the dancing and the guitar playing. It's not something I, publicly announce. At least, definitely not to patients.
What's a quote you live by every day?
There's no one quote I live by. Or rather, I can say I pick up quotes here and there, which will be very appropriate to the day that I've spent. But usually something with a positive spin.
What motivates you?
My kids.
How many languages can you speak?
3.
What are those languages? Sorry.
English, French, and Tamil.
How has your definition of rest changed over the years?
Rest can just mean like a reduction in your sensory stimuli. So it doesn't necessarily need to be like lying in a bed. I sometimes like rest seated outside with a nice breeze.
What's your favorite country you've ever traveled to?
Japan.
Early morning shifts or late night shifts?
Late night shifts.
Stay in or go out?
Stay in.
What's your dream car?
Ooh, I feel like my son would answer for me because he's like a car aficionado, but I like all BMWs.
What's your favorite music genre?
I love all kinds of music. What tends to be playing in the car is a lot of current pop, but I like to listen to a lot of old rock and indie as well.
And final question, what's one piece of advice you would give to students trying to pursue a career in medicine?
Stay committed. It's so hard, and I have to say, like, I really feel like the competition is a lot more fierce than it used to be. But if you want to do it, we need you, and just stay committed and stay passionate about it, and hopefully you will get in.